Surging cases of the coronavirus have forced city leaders in Philadelphia to reinstate an indoor mask mandate. Could it have effects across the country? Joining us, Dr. Jeff Potoff, UW Health's Chief Quality Officer. Great to see you, Doc. Let's talk about this subvariant of Omicron. It's called BA2. Omicron is insanely contagious, kind of regardless if you're vaccinated or not. What should we know about the subvariant?
Well, what we should know about the subvariant, believe it or not, but it's actually a little bit more contagious than the original Omicron variant. So that means, less time in contact with folks. You might pick it up. It likely will cause, amongst folks who are vaccinated, mild symptoms. Some people will get those yet. Certainly against those who are unvaccinated, it's going to cause symptoms. But the big story of the day is it's just more contagious.
We've seen a slight uptick in COVID cases here in Wisconsin, going from about 350 a day. We've doubled that. It's 600 a day. That's a far cry from where we've been. But, as far as hospitalizations and deaths go, that number is pretty non-existent as far as a fluctuation.
Yeah, you're right. So not unexpected that cases are up. We have this more contagious variant. We just had spring break. Not that long ago, we stopped wearing masks. We started gathering together. But unlike with other surges where we would see increased hospitalizations, increased deaths, it's possible through a combination of factors, folks who are vaccinated and boosted, and those who are not recently probably have already had Omicron. We may not see that severe disease this time around. We may see cases, but we may not see hospitalizations rise as rapidly as we have with other surges.
So I have to ask you, what's happening in Philly? Because they've brought their mask mandate back. What's going on there? And do you think we could see something happen similar in cities in Wisconsin, like in Milwaukee?
Yeah, I don't know if you'll see it in Milwaukee. In Philadelphia, like the rest of the country, they're seeing an increase in cases, but their increase has been, much higher. I think a 50% increase in cases. And, what they don't yet know is, will that increase in cases lead to an increase in hospitalizations? If it does, this bet to put masks back in place will be a good one. It'll reduce hospitalizations. It'll reduce deaths. If we don't see an increase in hospitalization with this surge, then it's a preventative measure that won't hurt anything, but may not have actually helped.
It's eye-opening how many people got Omicron. I saw one report coming that says 3 out of 4 people should be immune from Omicron. Does that mean you could possibly also be immune from the subvariant?
Yeah, there's a good chance. So we know that with natural immunity, which it's likely that a lot of people have come in contact with Omicron, a lot of them will have some immunity. We don't know exactly how good. Some people develop good immunity from infection. Some people don't develop any. Some people have it last a number of months. Some people only a couple of months. But if you have immunity against Omicron, you likely are not going to get really sick from this subvariant. You might have some symptoms, but you probably won't have to go to the hospital.
Okay, and we still need to get vaccinated or not, because we're still getting sick whether or not we get vaccinated or not.
Yeah, so those who are vaccinated and boosted, they're less likely to develop symptoms than people who are unvaccinated. Now, it's not like it originally was 94% effective. From from a week or two after you're vaccinated, about 60% effective. But the big benefit to being boosted, vaccinated, is you reduce that severe disease. You reduce hospitalizations, you reduce deaths. Those are the things that bring back mask mandates. So if you like this freedom, you like going out to the restaurant and hanging out with folks, get boosted, and that likely preserves our ability to not necessarily have to have mask mandates, even as this variant is increasing our cases.
Appreciate your time, Dr. Jeff Potoff from UW Health. Lots of good info there.
Thanks.